You're so welcome to join the conversation today with some experts and real key thinkers in the field of mental health and wellbeing, and also contributors to a new book that we are publishing in collaboration with Elsevier, focused on this very topic. So first of all, I'd like to introduce you to Professor Holly Blake. Holly, would you like to say hello?
Hello, everyone. It's very nice that you've joined us today, and we're looking forward to talking to you about this really important topic.
Thanks, Holly. And Holly is a professor of behavioural medicine at the University of Nottingham and has a really long career in research and practice around this very specific topic around workplace wellbeing. So thank you, Holly, for joining us. And Dr. Anne Felton.
Good morning, everybody. Thank you for inviting me to be here today. It's a delight to talk to you about this really important topic.
Thank you, Anne. And again, Anne brings a huge wealth of expertise. She's currently the head of Department of Health and Allied Professionals at Nottingham Trent University, and shares with me a professional background in mental health nursing and a real passion, and again, the research and practice around health and wellbeing, particularly for student nurses and midwives. So we'll hear some insights from both Holly and Anne in just a moment. It's my real pleasure to join you as the Deputy Chief Exec of the Florence Nightingale Foundation, and also to bring my passion and commitment to raising awareness and offering today, we hope, some tools and practical strategies for you to consider your own mental health wellbeing, and also to be thinking about how you can influence that of your community and the organisation and structures we work within. So if I could just get the next slide, please, Debs, that's brilliant, thank you. So we will be sharing with you a little bit of that evidence and theory around mental health and wellbeing for students specifically. And Holly will be sharing that with us. And then we're going to move for the majority of the time we have with you to look at some practical strategies which facilitate and enable the mental well-being and health of nursing and midwifery students to be supported. We will have some time to answer some questions as well. So if you do have any questions at all, please pop them in the Q&A. And we'll be joined by one of the team from Elsevier, Debs, who will be gathering those questions and putting them to myself and Holly and Anne towards the end of the session. So please do take that opportunity. So without further ado, let's use this precious time well. Thank you, Holly, for starting us off with that theory and research around mental health.
That's great. If we could have the next slide, that's perfect. Thank you, Gemma. I guess you're all here for different reasons and coming from different places. You may be here because you've experienced mental health problems in the past, or you're experiencing them now, or it might be just because you've embarked on nursing and midwifery studies and you want to know how to look after your mental health and well-being as you progress through your studies and through your careers. But one of the most important messages to convey here is that mental health problems are really very common. According to the World Health Organization, 1 in 4 people in the world will be affected by mental ill health at some point in their lives. And students are at higher risk of developing mental health problems. And research shows that many people first experience problems with their mental health, or they first seek help for mental health issues when they're at university. Not to say that studying is not really enjoyable, it is. It's an enjoyable endeavour, but it also brings a lot of challenges. For many students, this might include leaving home for the first time, finding housing, working or living with new people, and trying to manage existing friendships with friends and family. And as you go along, you might worry about how you'll cope with balancing placements, coursework, deadlines and exams. Some students also have to balance study with caregiving responsibilities and other work like paid jobs or other responsibilities. But overall, the mental health and well-being of higher education students is something that's becoming an increasing concern and something that we really want to pay attention to in the sector. Next slide, please. Thank you. And this has all been exacerbated, hasn't it, by the COVID-19 pandemic? It's something we've all experienced. In England, the National Union of Students undertook a survey that showed that more than half of students felt their mental health had suffered because of the pandemic. I've been exploring this further in my own research, and that's highlighted that there are many practical, emotional, environmental and social challenges that university students have experienced as a result of pandemic lockdowns and all of the changes that the pandemic has brought to university life. It's really important to recognise that structured support for student mental health varies a lot between countries and academic institutions. Recently, in the World Health Organization World Mental Health International College Student Project, a series of surveys was conducted in 19 colleges and universities across 8 countries. And that was Australia, Belgium, Germany, Mexico, Northern Ireland, South Africa, Spain, and the United States. And in that study, they found that 35% of first-year students met the diagnostic criteria for a common mental health problem. Although we know that many students struggle with mental health during their studies, very few actually access mental health support services. And in fact, in the UK, this is only 1 in 5. But it's important to recognise that the number of students seeking help in international studies is even lower than that. So the World Mental Health International College Student Project found that 1 in 4 was seeking help. And the reasons for this, of course, are very varied. As one example, our recent UK-based research on the experiences of international students studying abroad showed that there was high stigma around mental health in some cultures, and this prevented students from accessing supportive services that were available at their institutions. In our study, international students preferred to handle the problem alone or speak to their friends and family. So barriers to accessing help seem to be related to personal attitudes towards mental health and the stigma around mental health. And this was also something that was found in the World Health Organization's college student project as well, that I mentioned earlier. So research has shown us that stigma is a key barrier to access to supportive services and utilisation of these services on offer. And this is particularly the case in low and middle income countries. Just giving you one example, a recent research study explored the specific content of mental health stigma among Nigerian university healthcare students. And in this study, there was a relationship between stigma and religious beliefs, and students that had depression and anxiety were actually less likely to use mental health services. So the people who needed it most were less likely to access that support. And of course, it varies, doesn't it, across the world. Sometimes the demand for mental health services far exceeds the available resources, and that's true in healthcare and in higher education. So having personal strategies to manage your own well-being and support the well-being of others around you is really important. And we're going to come back to that a bit later when Gemma and Anne give their examples. Next slide, please. So it's been a really tough few years, hasn't it? And the impact of this long-lasting pandemic is something that we've all experienced worldwide. The pressure for people working in health and care services has been immense. Health and social care have been in the spotlight during this time, and frontline workers providing direct patient care have been particularly at risk. The research identifies some very interesting patterns in the risk for mental ill health because of the pandemic. And as some examples here, studies have shown differences between occupational groups, with nurses being at higher risk for mental ill health than medics, for example. We know that those at greatest risk tend to be younger, female, and those who care for people who are vulnerable. People with less clinical experience, training and support have increased risk of mental ill health. So you can see how nursing and midwifery students might be at high risk. These impacts are likely to last for a long time, and we need to make sure that we look after the mental well-being of the health and care workforce globally. And of course, this is really important in areas of the world where healthcare staff are reporting poor well-being and our healthcare students, but there may be less structured services to support them. And we've recently done some research in Nottingham on the well-being of nurses in Saudi Arabia and Nigeria that highlights the lack of structured support services. So there's a lot of work to be done. Next slide, please. Thank you. Coming back to the pandemic, let me tell you about the ICON study. So this was a research study we conducted to look at the impact of COVID-19 on the wellbeing of the UK nursing and midwifery workforce. This was a longitudinal survey, which means we collected online survey data at 3 different time points in 2020 with nurses, midwives, and students from those professions. And you can read a bit more about this in our publications. There's more coming out at the moment. But the main findings are important. It highlighted the negative impact of the pandemic on psychological well-being of nurses and midwives, with a high prevalence of stress, anxiety, and even emerging signs of trauma, post-traumatic stress disorder. Next slide, please. And this is relevant to students. It's relevant to nursing and midwifery students because you are the health and care workforce of the future. Healthcare trainees share similar risk factors to healthcare professionals, but they are an under-researched and often overlooked group. They make a valuable contribution to the health and care workforce. In some countries, like in the UK, many senior trainees were voluntarily mobilised into the healthcare services to support patient care during the pandemic. In general, college and university students reported fear, disturbed sleep, depression, and anxiety during the pandemic. And anxiety levels for college and university students have actually been found to be higher than those reported by university staff, and almost double that reported by healthcare professionals. So we need to look after our students. The psychological impacts were found to be higher in students in their final year, their graduating year, and in those living in severely afflicted areas. So perhaps those areas that were resource poor in terms of treatments or had fewer vaccinations and so on, higher case numbers. A study in the United States of America found that a higher proportion of college students also reported concerns for the health of their families, difficulties in concentrating, decreased social interactions because of all the physical distancing, and increased concerns about their academic performance as well. At the beginning of the pandemic in 2020, we conducted some research here that specifically explored the impacts of the pandemic on healthcare students. And we interviewed students from 13 universities across the UK, and we found high levels of stress and low well-being at that time. Next slide, please. We asked students how they've been affected during the pandemic, and these are some of the issues that they raised. You might relate to some of these. The rapid transition to online learning, the disruption to course delivery, assessments and placements made them worried about their academic performance and preparedness for their future careers in clinical practice. And many of them experienced personal and practical issues, so perhaps with their accommodation or with their finances. On a social level, many of the students had experienced low mood and they became isolated and lonely as they struggled to perhaps establish new relationships at university and make friendships during lockdowns, or simply just connect with other people. And some of them had experienced physical health issues or bereavement, which may or may not have been related to COVID-19. As students yourselves, I think you might relate to some of these issues. Next slide, please. So in this session, we want to share with you some examples of how you can look after your mental health as a student. These 3 examples include a digital support package. We'll give you a little bit of information about this, but then signpost you for where you can read more. We'll then focus on maintaining your energy and managing your emotions. And we'll talk to you about an initiative called the Bridge Network. And there are many examples of good practice out there, and we've just pulled out a few to give you examples today. Next slide, please. So very early on in the pandemic, at the University of Nottingham, we developed a digital support package for health and care workers. And this was all about mitigating the impact of the pandemic on psychological well-being. And we know that this was needed because it's been accessed by over 70,000 people in the world, including health and social care professionals and healthcare students from across the globe. And this online package gives practical suggestions for what you can do and where you can go for support. And it's across 6 core areas. And you can read a lot more about this in our publications. We're limited for time today, but there's lots more detail there. And while the package is aimed at health and care workers, it's very relevant to nursing and midwifery students because you'll be working in clinical areas both during your training and in the future. And this package starts with a focus on the importance of organisations and managers and how they can be proactive in advocating wellbeing and generating a team environment that's psychologically safe. And by this, we mean an environment in which healthcare professionals and students feel supported and feel comfortable to speak up and speak openly about their mental well-being. And that's one of the most important things, being able to share feelings and speak openly. It provides guidance on communication and reducing social stigma. Many healthcare professionals have experienced social stigma around COVID because of the place in which they were working and their high exposure to the virus. And we talk about the importance of accessing peer and family support. Social support outside of the workplace is important for buffering stress, but actually healthcare workers and often healthcare students can neglect relationships with friends and family because of heavy workloads. And of course, this has been very difficult over the last 2 years during the pandemic because many staff and students as well have had concerns about infecting others due to their own occupational exposure to the virus. So in this digital support package, we talk about the value of training in psychological first aid. And this is a way of gaining some skills to be able to signpost colleagues to help and support, as well as looking after your own well-being. And we focus very much on self-care strategies. And by self-care, we mean how to look after your health and well-being while at work or during studies or on clinical placements. And this might be through making sure you get adequate rest, taking work breaks and what the regulations are around that, how to manage fatigue, which some people struggle with during clinical practice and shift work. So learning how to deal with shift work and, having a healthy lifestyle and eating and exercising well and resting around that. Staying hydrated, of course, is a very important element of healthy lifestyles as well. And we also talk about the importance of managing emotions. Emotions are very varied, and we pulled out some examples today that Gemma will expand on a little in her section about managing your own energy. But in this digital package, you can get more information about moral injury, coping, feelings of guilt, grief, fear, anxiety and depression, and the range of emotions that clinical staff and clinical students might experience. And strategies, of course, on preventing burnout and psychological trauma. So it's all about pacing yourself, self-care, looking after yourself. And asking people to reflect on their own self-care is really important in our disciplines because healthcare workers often deprioritise their own health and well-being in favour of patient care because you're there to look after people, but you need to look after yourself too. And this e-package includes advice from experts in mental well-being, as well as those with direct pandemic experiences from the front line, as well as signposting to public mental health guidance, which has been variable globally. So this pulls all the resources into one place. And actually, this package formed the foundation for the topics included in our new book with Elsevier on health and well-being at work for nurses and midwives. And that's a book that's going to be released early next year. And in this text, you'll be able to read more about this package, read about all of the areas that we talk about in this conceptual model in depth. And there are chapters on each topic illustrated with real life case studies from nurses and midwives, so people who know your experiences as students and then qualified healthcare professionals. So that was a little bit of background about mental health, and I'm now going to hand over to Gemma, who's going to talk to you about how to maintain your energy. We're moving into practical examples here.
Thank you ever so much, Holly. And I guess what I want to start off by saying is that for the vast majority of those of us that work within a health and social care setting, the development of a mental health problem is unlikely. And the majority of us will work through strategies in order to maintain our energy and our well-being in what is a very challenging and complex, demanding context and work environment. I often hear people in other industries using the terminology like we're on a sprint. And so we accept that it's long hours and it's intensive work, but we'll sprint to the finish line and then we'll have a planned rest at the end of that. And that's not our world as nurses and midwives. We have to think about how we are going to maintain our energy in the long term so that we can have a really fruitful and maintain our motivation for the work that we do, because the work that we do is so important. So if I could have the next slide, please, Debs. I want to talk you through the concept of leadership energies. And this is based on principles that are drawn from the leadership literature, not necessarily the health and social care literature, and really to start to think differently about how we invest our time on a day-to-day, weekly, monthly basis, because we are absolutely guaranteed to only have 24 hours in the day. Time absolutely is a finite resource. But what I'd like to share with you today is some thoughts around how our energy can be a different story. And that if we think that every thought we have, every emotion, feeling and behaviour influences our energy levels, we can start to think about very intentional ways that we can either engage in activity that depletes us, or alternatively make choices to rejuvenate our energy. And this can be far more in our control than we perhaps imagine it to be. So just before we start, I'm going to ask for a little bit of participation here. I can't see you, but I hope you'll join in. Just on your piece of paper in front of you, have a think about where you would rate yourself on a scale of 0 to 10 in terms of your energy levels right now. So for me, if I give my example, I'm probably around a 6 at the moment. My energy levels deplete as the week goes along. But what I know as a result of doing this webinar with you today, having the opportunity to speak about something I feel really passionate about, and also to an international audience of student nurses and midwives, that will raise my energy levels. I will leave this hour feeling rejuvenated. And I chose to say yes to this opportunity because I am aware that having this opportunity to engage has that kind of impact on my energy. So let's move on to the next slide. So there are 4 different areas that we can think about when it comes to our energy levels. And I'm going to talk you through some practical examples of how we can pay attention to each one of these. But as we go through, again, just to encourage you to apply this to yourselves, what I'd like you to do is think about how you attend to these different areas of energy in your current ways of working and thinking and living, and whether there are areas that you think potentially you could take something from, you could take action, particularly in that area. Or you can think about the choices that you make around the environments that you work in, and make those very intentional decisions around where you choose to work and invest your time and energy based on some of the factors that we'll discuss. So I'll take you through each one of the physical, which is really about our health and well-being in terms of our physical fitness and all of the things that help us to maintain our energy from a physiological sense. Our spiritual, which is around the more internal motivations, the things that we gain energy from because they align with our passion, our values, our intention and our meaning. The emotional energy, which is about us being humans and relating to each other and the relationships that we build, how we feel valued in our organizations. And then the last one around the intellectual, and this is the energy that's associated with our opportunity to really delve deep and think critically and really indulge our curiosity into a certain area that we feel really interested in learning and developing more in. So next slide, please. Thanks, Debs. So starting off with the physical, and I think this is probably the one that we find easiest to get our heads around and think about in a real practical sense. So if we base our physical energy around our physical fitness, So this is about our body's ability to respond to what's required of us. And in nursing and midwifery, that's often about withstanding long periods of time on our feet, moving around. We are not obviously office workers, and so we need to have that ability to retain our energy to respond to that demand. And there are some really simple but highly evidence-based strategies that we can use to ensure that we attend to this. So thinking about our diet, particularly eating a healthy, balanced, regular diet, was something that often we neglect because our busyness starts to take over. Thinking about our sleep patterns as well, and again, challenging in a nursing and midwifery context when we think about how shift patterns might disrupt our regular sleep patterns. Thinking also about our engagement with the outside world, whether that be about exercising through a run or a walk, but certainly growing evidence to say that our time spent in nature has a really positive implications for our well-being and our energy. And then finally, this funny little fox image here is really reminding us, me especially, to take those precious moments to really slow down, take a break and reconnect with ourselves. There's always so many competing demands which pull our attention in lots of different directions. But one of the things I've learned is by taking some time away, and even if it's just for a few moments, grounding myself in having a hot drink or something to eat, but really focusing on that moment in time does have that effect of rejuvenating our energy. And actually, one thing I will confess to, when I am feeling overloaded and there's lots to be done, each of these physical strategies for maintaining energy are the things that I start to neglect. So diet goes out the window. I tend to just eat for fuel rather than for thinking about my well-being. I love to exercise. I run early in the morning, and often I'll start to neglect that because I think the work needs to be done. And sleep patterns for me are something that are a real indicator that those stress levels are high. So these are often the areas that we can make really easy changes to, but are often the areas that we neglect when we're feeling under pressure. Next slide, please, Debs. So our next area is our emotions, and this is one that requires that level of self-reflection and really an investment in raising to our consciousness how different emotions affect our energy. And what I would encourage you to do in this area is to spend a few days taking note of this. So rather than us just reacting and responding to the ways in which things affect our energy levels, that we make a conscious effort to take note of that and slow down in terms of what our response will be. And then we can start to see some patterns in particular activities or actions or interactions with others that either trigger very positive or negative emotions. And on the next slide, what I'd like to just share with you is some strategies really. So next slide, please, Debs. Some strategies that when we do notice the impact of those negative emotions, which tends to be a physiological reaction. Often we feel our heart rate increase, maybe we blush a little, we start to think quite sort of tunnel vision, and that kind of fight or flight response starts to kick in. And quite often, if I react in that moment, the response that I will give will lack consideration. I won't have been able to think about the bigger picture. I might feel quite overwhelmed as well in that moment. So there's great evidence to show that the effect of deep abdominal breathing can actually diffuse that reaction, that physiological reaction, and quite quickly bring us into a state where we can think more clearly and consciously decide on the best course of action and reaction. We also need to remember that when it comes to our emotions, it's not just about how others impose a reaction on us. We also have an opportunity to initiate positive emotions in others. So particularly when we express appreciation to others, really take time to understand their motives and aspirations. And the evidence shows us that actually, obviously, that has a positive implications for the person that we're offering that to, but also for ourselves as well. So really making those efforts to have that human connection with those that we are working with. And then the final area is about our outlook on a situation and how we can, through taking that step back for a moment, and rather than reacting, just thinking about how we can positively reframe a situation. So there may be some people that you think they seem to react to these kinds of scenarios in a different way to me. So how might they see this situation? Sometimes we can't control the outcome of a situation. And so what we need to think more about is, how can I learn from this so that I can still get a good outcome, even though the situation itself is quite challenging. And then regardless of that outcome, we have the opportunity to grow and learn. That's often really relevant in things like assessments, job interviews, those kinds of things where we focus on the outcome, the percentage we're given, whether we're successful or not in the job, and we can sometimes become very preoccupied with that, and that has that energy depleting effect. But actually, if we can think about each of those situations as an opportunity to learn and grow regardless of the outcome, we start to have a very different mindset around it. Next slide, please. The next is our intellectual or our mind energy, and this is an area that I can really identify with. The time where I get opportunity to really think deeply and delve and give my very best attention to a particular task, whether that's about learning or writing or responding to a request that's made of me. And often what we find is our reality is that we're juggling lots and lots of different tasks, and sometimes that can be praised within a nursing and midwifery culture. You're the person that seems to be able to always take on the next request or be able to spin lots of plates. But again, lots of evidence that says that over time that can be energy depleting, because we're never really giving those activities our full attention and we don't feel that we're doing our best work. We also have to be really aware of the context that we work and live in now, which encourages constantly to be switching time. And by that, I mean responding to lots and lots of different demands that grab our attention away from the task at hand. So that might be notifications on your phone, it might be emails, it could be numerous requests for your attention, which come in lots and lots of different directions. And some would even say we've got an attention crisis now, where we're so used to responding and spinning all of these plates. Actually, we find it really difficult to concentrate and focus. But for many of us, when we have the opportunity to do that, that really does enhance our energy. And our final one, this one is around our spiritual, and I think is possibly the one that's often the guiding force for many of us to have pursued a career in nursing and midwifery. And this is about finding a role that really aligns with your values, your internal motivations, and is really connected to your identity and your passions. And that on a day-to-day basis, you get opportunity to do what you feel you're best at and that you enjoy most. But also that we don't just think about this as a work area, that we consciously allocate the time that we have, those precious hours that we have each day, to areas of life that give us that energy rejuvenation. And we don't make any kind of assumptions around that. So some people, we say, oh, you know, they don't seem to have the right balance between work and life, but actually for some individuals their work is the energy enhancing area, and perhaps there are challenges within their family life that we're not aware of. So this is unique and personal to every single one of us. But really core to this is finding that sweet spot where we have the opportunity to really live our core values on our day-to-day. Next slide, please. So I'm going to introduce you now to Anne and hand over the baton to Anne. And I must say, not that I'm biased at all, but I see the Bridge Network as one of the most innovative approaches to supporting the mental health and well-being of students that I've ever come across. So I'm really excited for Anne to tell you more.
Thank you, Gemma. That's quite an amazing introduction. I'll try and live up to that one. So I'm going to talk to you this morning about the Bridge Network, which is a project that I was involved in developing with some student nurses and midwives in a role I had when I was working as an academic. There are some real key features of the network that I think are really important in terms of what we were trying to achieve, which was to offer something slightly different to students and to try and challenge some of those issues that we've heard about today, particularly from Holly, around access to getting support and the real challenges that stigma can pose, particularly as health professionals. It also draws on those ideas that although we're not always very good at looking after our own health and well-being, but recognizing that actually as health professionals we have some expertise in those areas. We do have some understanding about what promotes really good health. And particularly as mental health professionals that maybe and developing mental health professionals, that there's something that we can offer to draw on that expertise. So the Bridge Network is really founded in a really key idea in the context of mental health, which is peer support. And peer support exists in many sectors and is really growing within the mental health services, but is something which exists in lots of different aspects of health, social care, and kind of general sort of community and society. And it's really founded on that idea that having a shared identity and a shared experience offers a great deal to people, particularly when times are challenging or when people have been through difficult experiences. And we're seeing in the UK a kind of growing interest in the idea of peer support in relation to student wellbeing, with the growth of Student Minds, which is a national sort of organisation where students are involved in promoting mental health with other students. What was unique about the Bridge Network is that this project focused on actually a dual shared identity. So students were both healthcare students, but also students who identified that they had experienced mental distress. And again, picking up on the themes of some of the earlier discussion today, that is about not necessarily saying that that's about experiencing a mental health problem or having a particular diagnosis, although some of those people who worked with the Bridge Network did have. But it's about people who recognised and were willing to be open about the mental health challenges that they'd experienced. They also shared that identity as a healthcare student, and that recognition that perhaps some of the mechanisms that universities invest in and look at trying to support students with can be even harder for healthcare students to access. You know, obviously as students you spend much time away from the university setting, you're in mental health services, in health services during your kind of placement and practice experiences. And you're also experiencing all the additional challenges as has been identified that comes with that in terms of caring for people working in very demanding environments. And therefore the sort of solutions that we need to look at to try and offer support for those students are quite different. So the Bridge Network actually grew out of a conversation between myself and at the time a second-year student mental health nurse, who off of her own back and using her own initiative had put on a kind of health promotion activity for World Mental Health Day. That conversation really began to recognise some of those introductory issues that I was talking about around actually what is available for healthcare students in terms of promoting their well-being, and how much harder it can be for those students to take action around their well-being because of some of the stigma and some of the other challenges. We worked together to develop a project proposal, which then went on into being a pilot, in which we wanted to identify some specific peer support workers or peer supporters who came from the student group within the university, and who were willing to offer support to other students. It was a co-produced project, so actually it wasn't about me saying, you know, as an academic, this is what I think support looks like for you. We started with recruiting volunteer peer supporters to join us, and we had 6 initially that came across from different years of the programme, and actually from the different professions within the university at the time, the different healthcare professions. And then we worked with some people who were experts in peer support, who had got a great deal of experience of delivering peer support and of training peer support workers, particularly in mental health services. And they had a sort of dual role with us. They worked with the 6 peer supporters, myself, and also some other kind of key people from the university, including the counselling service, to actually get together and say, what do we want this to look like? What are the key issues that we need to think about? And I'll go on in a minute to sort of talk about what the group decided that the defining features of the Bridge Network were. But that really helped us think through lots of issues, from some of those deeper issues around how we create safety, how people feel about being open about their own distress or their caring experiences. So some of the people were also supporters of family members who experienced distress. So it really helped us kind of think about what that might look like, and how we dealt with some of those deeper issues, but also some of the practicalities, like where was the best place for these connections to happen? Was it most safe for that to take place within university settings, or would that feel like it was owned too much by the university? So we looked at kind of really what we wanted to do to set this up. What we decided on was to run regular groups, which were very open kind of spaces for any students to join and to come and have conversations about wellbeing. And some of those conversations to be structured around particular sort of areas that students found particularly challenging. So that might be about joining university, about going out on placement, about assessments. And the peer facilitators were trained to have those kind of group conversations, and those conversations about well-being. I don't know if I'm able to get the next slide, but if not, I shall just talk through the key principles that the group decided on that defined the Bridge Network. So these were ones that were developed by the peer facilitators, and they identified that it was a network that was absolutely about healthcare students. So it was owned and run by healthcare students for healthcare students. So that meant I had to be quite careful about my role and about support, how I offered that support kind of in the background for the group. It was run by students who share a mutual experience of being healthcare students and who experience emotional challenges. So it was that sort of bravery to be open about their own challenges, to offer that role modelling, particularly where students were a bit later on their course, and being able to share some real practical strategies about what had helped them, yes, about kind of manage the course, but also what had helped them manage their own well-being, particularly in some of those challenging times. And it was committed to providing a safe and supportive space for people to promote and explore mental well-being. So that explicit focus that it is about kind of psychological well-being. That it was inclusive, so they weren't, you know, it wasn't necessarily about people who openly experience mental health problems. It was very broad in terms of who could come within the group, and a real inclusive space. And a real recognition, as we've heard sort of consistently today, that it's about healthcare professionals absolutely taking care of other people, but also taking care of themselves and prioritising that well-being. So we were able to run the group and kind of begin to recruit our second round of peer facilitators and offer that support. There was also wider benefits, both for the peer supporters that were involved, but also they undertook much more kind of promotional activities in terms of making well-being much more visible within the institution, and encouraging people to have those conversations about well-being. Okay, thank you. I think that's all I was going to say about the Bridge Network.
So it looks like we've got some questions, and I think Debs has joined us. She's been keeping an eye on the Q&A.
So the first one I have is, were there any barriers in setting up the Bridge Network? And I think that's one for you.
Yes, there were. One of the benefits was having some really good champions within the institution. So the counselling service were amazing, and they offered supervision to the peer supporters, and we had some really key support within the school. But speaking frankly, we did also experience in some sectors some stigma as well, and some concerns from the institution about what we were trying to do, which came from a misunderstanding about what it was about, I think. But for me also showed the importance of powering through some of those challenges. And that's where my role in the group was quite important. I was a senior member of staff, so I was able to provide those assurances within the institution that we had thought through how we were going to keep our students safe. I think one of the other challenges, which is something that does come up a lot within innovations within health courses sometimes, is also the peer facilitators were really committed and did an incredible job, but themselves were also studying and juggling placement. So that was why it was really important to make sure that we had people at different stages of the course, and kind of quite a few peer facilitators involved, so there wasn't too much pressure on a small number.
Thank you, Anne. We also had a question around from somebody. It's like, do you have any suggestions, and this could be to anyone, or resources that you could share that would help somebody have a conversation with a colleague or one of their fellow students, that would, if they felt that they were not having a good time, or not maybe coping with the course?
Holly, would you like to go for that one?
I'm not sure I'm best placed to answer this one, but
okay.
I think one of the most important things is being able to start the conversation and keep it going. And I know that within the digital package that we created, there is a section in there on communication, and a lot of it is about the words, the choice of words that we use, and the type of phrases that we use that use non-stigmatizing language. So choosing words wisely. And so trying to avoid asking people, whether they're suffering from something, or, are they living with something? Have they got a mental health problem? That kind of thing. But just asking open questions about how they feel and how do they think they're getting on, and very much focusing on checking in with people on a regular basis. Because I think often often the best thing that people can do is demonstrate that it's okay that we can create this environment where it's okay to speak up. And I think people often feel that They can't share those things. And one of the things I actually noticed when Gemma was giving her presentation is how open she was and how she laid herself vulnerable by talking about the things that she struggled with and how she has overcome them. And I think that's a really great example of how you can model that it's actually okay that we all struggle with things from time to time, and use particular language to open up a conversation on a regular basis. And people may not open up the first time you speak to them, so it may take more than one attempt. And that's one of the reasons why when we interviewed students, for example, about the mental health impacts of the pandemic, one of the things that really came up was the importance of regular check-ins and the importance of feeling valued by people around them. So I think having regular conversations using non-stigmatizing language, and perhaps some kind of forum where people feel that they're being regularly checked in on, and not in a critical manner in terms of having a mental health issue, but let's actually reflect and talk about the situations that we've experienced and how have you got on with that. So I think some of it is around leadership, and some of it is around having the confidence to be a bit vulnerable and share some of your own experiences as well. Does anybody else want to add to that? I think I think there's actually a wealth of resources online around that.
I'd just add one place I found particularly helpful in the past is the Mental Health Foundation. They used to do a kind of Let's Talk Wellbeing Day, and very much about some of those issues, both within the workplace and universities. So I haven't looked for a little while, but they do tend to have a bit of guidance on kind of how do you have conversations about wellbeing, which absolutely reflects the principles that Holly's been talking about.
Is it okay to speak to my tutor about how I'm feeling? If I'm stressed or overwhelmed, I'm worried that they'll think I'm unable to cope. And I think that really relates back to that point around our fear of the stigma that's associated with emotional challenges and difficulties. I think we are now moving into a time where conversations around this topic are much more acceptable, and there's definitely been a move within health and social care workforce employers to really prioritise the well-being of staff and students. So the permission to have these types of conversations is there now. What I would suggest though is always about keeping yourself safe within these conversations. So it may not be your personal tutor that is the individual that you want to seek that support from, but there will be others within the university setting, perhaps within a welfare service, or others within the academic team where you feel comfortable to raise the challenges that you have. So it's just really being mindful of the relationships that you have with different individuals, and who is best placed really to offer you that support and have that conversation. But I think going back to Holly's point around sometimes demonstrating our vulnerability is actually an act of courage and bravery, and rather than implying that we're not able to cope, what we're showing is that we've got good self-awareness and we're reaching out for support where needed at a time that's going to be most helpful to have the least impact as possible on your ability to stay on the course and to do as well as you possibly can.
I saw a question on what employers can do to support wellbeing, and I wondered if I could just add a little bit to that. So we've obviously talked about openly having campaigns around mental health, being able to speak openly about mental health, and that's an issue of culture and how teams and line managers create a circumstance where people can feel it's okay to share. But I think from an employment level, there's lots of other things that can be done, and progressive organisations often put in place really good policies to support staff. So they might have things like a hydration policy so that staff are really clear when they can take a drink and where and how it's appropriate. And they might have policies around psychological well-being as well, and I think those sorts of things are important. One thing that the hospital that I'm based within, Nottingham University Hospital's NHS Trust, did during the pandemic, but it's relevant at all times, not just in a pandemic, is the provision of high quality rest spaces. Because if you think about working in a busy clinical area, often students and staff aren't sure where they can go to take some time out and take a break. And that was something that was really, really valued by both students and staff, is having these places where they could just go and have time out. And these places were actually staffed by mental health support workers who were actually NHS staff who had qualified in psychological first aid, and that they were able to signpost people to mental health support. So it's something that was very effective during the pandemic, but we should learn from that and think that people actually need this support all the time. And would that be something that could be put in place long term? So rest space, and we've talked about regular check-ins, good communication, wellbeing champions, visible leadership that's very pro wellbeing, I think is very important. You know, other examples are things like staff physiotherapy services for when people have musculoskeletal problems at work. And, you know, so there's so many things that you can do around physical health and mental health at the same time. And it's important to recognise that, you know, that we can learn from these examples, and a lot of these examples will be provided in our book on health and wellbeing at work for nurses and midwives. So we hope you can get some practical tips from there.
Thank you, Holly. I think we are running out of time now, so that seems like a really excellent point to close the webinar on. And if you have found what we've discussed today interesting and helpful, as Holly said, a lot of the materials will be discussed in more depth with more examples and resources within the book. So please do look out for that when it's published and available to buy in January. But thank you all for joining us and for your excellent questions. It's been a pleasure, and thank you to Anne and Holly as well for providing their insights and expertise.
Thank you, it's a pleasure. Bye.
Bye-bye.